Dr. Ken Landau. Thanks for watching. Let's talk about Nexium and its related compounds. Let's talk about these heartburn treating medicines because they're in the news a lot lately. You can't watch the television without being bombarded by advertisements for Nexium 24 hours or Prevacid. A lot of aggressive marketing, ads to consumers, ads to physicians. Right now in the United States, there are more than 15 million people taking these drugs. The sales peak was in 2008, as far as money was concerned, when they brought into the manufacturers more than $14 billion. It's important to realize, however, that 70% of people taking the drugs in the short term, and probably somewhere between 25 and 50% of people taking long-term medicines in this family, Nexium, Omeprazole, Prevacid, all of these kind of medicines, probably taking them inappropriately. If you take them for too long and you don't have any benefit, but you have the possibility of the side effect like bone loss, bone fracture, increased bacterial overgrowth, well, you're doing yourself a disservice. It's thought that about 1 in 5 individuals are going to have heartburn at least weekly, and you do not need to reach for one of these fancy drugs like Nexium 24 hours. That's inappropriate. As a matter of fact, they don't work that fast. What are the medicines used for? These medicines are used to treat gastroesophageal reflux disease if it occurs more than 2 times a week. They're used to treat erosive esophagitis. You have the pain in your chest. You see the gastroenterologist who looks into your esophagus with the tube. That's how that diagnosis is made. If you need to take long-term aspirin and you're over 60 or you have a history of gastric ulcer, well, these drugs are used to help prevent recurrence of the ulcer. If you happen to have a gastric ulcer, well, it's probably due to Helicobacter pylori, that's a bacteria, and these drugs are used in addition to antibiotics to treat that condition. They help prevent recurrence of duodenal ulcers, and it's important to realize that for the overwhelming majority of people, the absence of symptoms does not mean the absence of disease. So if you take the drugs, the symptoms go away, that doesn't mean you're cured. You actually could even have gastric cancer without having any symptoms. Now, you use different doses and different timetables depending on what particular underlying condition you happen to treat, but we have a lot of choices. We have Prilosec or Omeprazole. We have a very close relative, Nexium or esomeprazole. We have Acifex and Protonix. We have Prevacid. We have Dexilant. And we have another one known as Zegrid that's just the omeprazole or Prilosec plus a little sodium bicarbonate. Now, there are 7 of these drugs available in the United States, and 4 of them are available over the counter. And for the most part, it doesn't make any difference which one you pick. The prescription medicines are not stronger than the over-the-counter medicines, and there isn't much to choose from in opting for one pill versus another. It's personal preference. So what do we look at? Well, we look at these drugs that bring in an awful lot of money. Actually, the last year that Nexium, prescription Nexium, was on patent, it brought in close to $4 billion. But Consumer Reports in June of 2016 said, hey, 70% of the people taking these drugs are taking them inappropriately when a less potent acid reducer, a safer drug, would probably be a better choice. And these drugs are not appropriate for the occasional heartburn sufferer. They don't work that quickly. You have to take them for 2, 3, 4 days before they really start to work. And it's very important to realize that you can have side effects with the drugs. So the American Gastroenterological Association says you should take the drugs for the shortest period of time and get off of them. If you're on them for too long a time period, it might be hard to get off of them because then you might have a resurgence in the amount of acid that you produce. And that might cause symptoms. Now, if you happen to have occasional heartburn, much better choice would be Maalox, Mylanta, Rolaids, Tums. And if you don't like them, maybe you want to go for Tagamet or cimetidine, Zantac or ranitidine, one of those medicines that we call histamine blockers. They don't work as quickly as the antacids, but they're longer lasting, and they have relatively few side effects, and they're relatively cheap. If you have the symptoms more than twice a week, then you might want to consider one of these drugs that was a prescription and now for the most part over the counter, as exemplified by Prilosec or Omeprazole that was first approved in 1989. A very similar drug, actually has the same ingredient, is Nexium. Nexium was approved in 2001, and it was a drug in 2013 that gained the dubious distinction of being one of the drugs that Medicare spent the most of your tax dollars on. Medicare spent $2.5 billion for just this one drug. Now, it's important to realize that when you take these drugs, you have to follow a special protocol. You have to take them about 30 to 60 minutes before you eat, typically before breakfast. Or you could take them an hour, say, before the evening meal if your major symptoms occur at night. Typically, the drugs are thought to last for most of the day, but it's only about a 12 to a 16-hour day. It's not a 24-hour day. If you take them with food, they're probably not going to be absorbed nearly as well as expected. Probably lose about half of the potency. Now, all drugs have some side effects. The minor side effects of these drugs, the acid relievers, we call them proton pump inhibitors, or PPIs. Nexium 24 hours is a typical example. Well, the side effects include headache or abdominal pain or nausea or maybe some gas or constipation or maybe even a dry mouth. But sometimes people develop bacterial overgrowth in the intestine and can get significant diarrhea. You could get that thing called Clostridium difficile diarrhea, and people have died because of that. Well, even though the medicines have been available for about 30 years, some side effects have just recently been discovered. Well, what kind of side effects? Well, kidney disease, low magnesium levels leading to low calcium or osteoporosis, low B12 levels, pneumonia, stroke, that C. difficile diarrhea I was talking about, and now an increased incidence of dementia. So the warnings came out in 2014 for basically the first time, suggesting these drugs could cause acute kidney disease, blood in the urine, decreased amount of urine. And in 2016, they were associated with chronic kidney disease, increasing the incidence by somewhere between 20 and 100%. Well, they also can cause bone fractures, especially if you take the drugs for a long period of time or if you take them twice a day. They also can cause lupus, the skin type. They can cause low levels of vitamin B12, especially if you take the drugs for more than about 3 years, and they can decrease the amount of potassium and decrease the amount of magnesium in the system. Well, if they decrease the amount of magnesium, magnesium is in muscles. Muscles, when they don't work as well, can lead to falls. You can have arrhythmias because the heart is a muscle too. Other side effects of low magnesium would include tetany and weakness and tremors and convulsions and fractures and even asthma. Well, if you have low levels of magnesium, chances are you'll have low levels of calcium too, and they, of course, impact on the bone. And in fact, just in May of 2010, the Food and Drug Administration mandated warnings on these kind of drugs that they might increase the incidence of fracture of the hip, the wrist, or the spine. They did that in 2010. The lawsuits began in 2011. And because they counteract the acid in the stomach, that allows some bacteria to grow in the stomach or to grow in the large intestine. When they grow in the stomach, then you could aspirate them. They go up the esophagus and into the lungs, and that's where the pneumonia comes from. The drugs also increase the concentration in your system of certain kind of drugs. Drugs like methotrexate used for rheumatoid arthritis, so you have to be a little bit careful. The Danish Heart Foundation presented information at a recent American Heart Association meeting looking at a lot of people in Denmark, following them for a significant period of time, and found the incidence of stroke increased between 30% and 90% in people who were taking these classes of drugs. And German researchers, again looking at large database of individuals, found that those who regularly took the PPIs, proton pump inhibitors like Nexium SR, or Nexium 24-hour, well, they increased their risk of dementia. Now, we're not saying this is necessarily cause and effect. These are observational studies. But we can say that at least some evidence, maybe good, maybe not so good, links these drugs to a series of complications. And we know in animals they might cause a tumor known as a carcinoid tumor. Not present in humans, at least so far. You also have to be careful if you're taking St. John's wort or if you take rifampin. We know that because the acid is reduced in the stomach, if you need to absorb iron salt or if you need to absorb digitalis preparations, might not happen. Interferes with warfarin, raises the level of Valium in the system. You have to be very careful if you're taking certain HIV medicines. And if you take Plavix, the Plavix won't be activated. So it won't work to help prevent clots. Well, in order to take Nexium and get the full effect, you have to take it for at least 4 days. Nexium is very popular, obviously. It comes in tablets or capsules. You have to take it for about 14 days. And if you have simple gastroesophageal reflux disease, that may well be enough. Actually, if you're taking it without the observation of a physician, it's recommended you only take the drug for about 1 dose, that's 14 days, every 4 months. Now again, you take it on an empty stomach. And it's important to realize that half of the people don't do this. And if you don't do this, the drugs are not going to work. And because they have a short half-life, you can't take them hours before you eat. You have to take them just a little bit before you eat because the drugs have to get absorbed through the bloodstream, into the bloodstream, through the system, go back to the stomach, and then they inactivate what's known as a proton pump that's in the acid-creating cells in the stomach. Now, not all people are able to rapidly or to metabolize the Nexium or any of these other drugs in a similar fashion. Some people are very rapid metabolizers. Certainly people from North America tend to metabolize them rapidly, and they tend not to work nearly as good as they do, say, in Asians. And in 15 to 20% of Asians, there is slow metabolism, so the concentration builds up and the medicines seem to work better. Now, if you take the drugs, can you expect 24-hour relief? No. If you take the drugs, does the stomach stop producing acid for a considerable period of time? Yeah, about 14, 16, 17 hours, but not for the entire day. So you might actually have to take the dose twice. Once before breakfast and once before dinner. That happens not infrequently. And when we look at the percentage of people in whom the medicine works, it's not 100%. The medicine seems to work in anywhere between about 25 and 60 or 70% of the people. So not everybody taking the medicines who has legitimate indication is going to get better. We know that if you take the drug just before morning, just before your breakfast, 30 to 60 minutes, well, you may well have to supplement it with a dose before dinner. Even in healthy people, it seems that at a maximum dose of the Nexium, we still won't fully suppress the acid production. Now, if you don't want to take one of these proton pump inhibitors, what can you do if you happen to have heartburn? Well, you could take one of the medicines like Tagamet or cimetidine. That would be okay. They work about half of the time. You could go and lose weight, avoid cigarettes and alcohol that precipitate heartburn, sleep at a little incline, avoid some of the foods that seem to make it worse, maybe some coffee, maybe some tomatoes, maybe some citrus, maybe eat smaller food. Don't lie down immediately after you eat. And if there are trigger foods, avoid them. That makes sense, obviously. Heartburn, by the way, simply is a burning in the chest, typically in the center of the chest, sometimes nausea, sometimes you get some reflux of food up into the esophagus. Now, it's important to realize that many people, in fact, a significant percentage of people who think they have heartburn don't have heartburn per se. They have what we call functional dyspepsia. There is nothing wrong with acid secretion. There is nothing wrong with where the acid is. There is nothing wrong with the esophagus. They just have that burning. They have exactly the same symptoms. And for those people who have functional dyspepsia, exactly mimics the gastroesophageal reflux disease, taking these medicines is not going to help. And that's why a significant percentage of people who take these medicines don't seem to get better. Now, it's important to realize that if we look at people who are taking the Nexium, and they really have heartburn, gastroesophageal reflux disease, somewhere between 60–70% probably are going to get better. If we use a placebo, an inactive sugar pill, 40 or 45% of the people are going to get better. So the drugs don't perform miracles. If you happen to have an erosion in the esophagus, we call that erosive esophagitis, these drugs work very well. They work probably 90% of the time or even more. And once you're healed, after say 4 to 8 weeks, then you can take any of the medicines. You can go and take that Tagamet, and that seems to hold. It doesn't get you better, but once you're better, it seems to keep you there. Well, if you happen to need a lot of aspirin, or aspirin substitute, maybe you're going to take something like the ibuprofen or the Motrin, and you're over age 60 or you've had a history of gastric ulcer, well, chances are that the medicines are going to irritate your stomach, and then it seems that these drugs work so much better than taking the Tagamet or the ranitidine or the Zantac. So if you happen to be at risk for a gastric ulcer and you're taking aspirin, maybe because rheumatoid arthritis, maybe because you have migraines or some other reason, these are definitely the drugs to use. Now, it's also important to realize that if you have a stomach ulcer, typically ulcers are caused by a bacteria. They're an infection. And the bacteria is known as Helicobacter pylori. And Helicobacter is treated with a little of this antacid. You take only for 10 days. You take the proton pump inhibitor, the Nexium, or similar drug, for 10 days, along with at least 2 antibiotics, say amoxicillin and clarithromycin. If you do that, chances are you're going to be in relatively good shape. Unfortunately, it seems that these medicines have very short half-life. They're working on some medicines that are going to work for a lot longer. They're going to have a half-life of maybe about 7 hours. And if that actually comes to pass, then probably 1 pill is going to be sufficient for any 24-hour period. Now, the pricing of these pills is all over the map. They have rebates that are available until the end of 2017 for the Nexium 24 hours, but you can even get a prescription for the over-the-counter medicine. Go figure that one out. Well, Nexium, if you get the prescription, can cost as much as $10 a day if you pay cash. On the other hand, if you get the Nexium over-the-counter, the 24-hour Nexium, that's probably only going to cost you $16 for the full course. Or if you get Omeprazole, which is Prilosec, and Prilosec has basically the same chemical in it as the Nexium, well, that's only going to cost you $12, $13. There's a question about why the price of these medicines is so high. There is no good reason for the medicines being so expensive. They're dirt cheap to produce. As you can see, the price has fallen from $10 a pill, if you get the prescription, to a total of about $10 or $20 for an entire course of therapy. And remember, a lot of people who reach for these drugs are going to be sadly disappointed when they find that their symptoms are still there. Symptoms still there either because they have a legitimate heartburn, but the medicines don't work fast enough, or they have that functional dyspepsia I told you about. So consider whether these medicines are appropriate. Do as the Gastrointestinal Association says, take them for a relatively short period of time, and do be alert that the generics are just as good as the name brands for many of these products. Anyway, thanks for watching. I'm Dr. Ken Landau.